Okay, ma'am, should we start now?
Yeah.
Good evening. I welcome everyone to the 48th Kamla Puri Sabharwal Memorial Lecture on addressing all forms of malnutrition, lessons from global experience. We are fortunate to have Dr. MEERA SHEKAR with us today to deliver the lecture. She is an alumna of Lady Irwin College and we are very proud of her. I welcome Dr. Prema Ramachandran, the chairperson for today's lecture, and Dr. Anupa Sidhu, director, Lady Irwin College. It gives me immense pleasure to welcome all of you today. We have with us a lot of dignitaries, and we have with us speakers, past speakers of the KPS lecture, former faculty members of the Department of Food and Nutrition, dietitians from various hospitals, health professionals, faculty members and students of Lady Irwin and other colleges. The KPS lecture was instituted in the memory of Kamla Puri Sabharwal by her husband, Mr. M.M. Sabharwal. The lecture is an important annual event of the Department of Food and Nutrition, Lady Irwin College. Mr. M.M. Sabharwal is not with us anymore. We miss his able guidance and presence, but his vision, inspiration, and blessings will always remain with us. I extend a warm welcome to the family members and friends of Mr. Sabharwal who have joined the virtual lecture today. Dr. C. Gopalan was a scientist of international eminence who spearheaded the cause of nutrition science for several decades. Dr. Gopalan has been a mentor and a source of inspiration for the faculty and students of the Department of Food and Nutrition. His contribution to the field of nutrition has been outstanding and commendable. His passing away has been a tremendous loss to the nutrition fraternity. Dr. Gopalan had chaired the KPS Memorial Lecture for more than 3 decades, and he took a special interest in this event. We will always be indebted to him for his involvement, advice, and guidance. Dr. Prema Ramachandran, Director, Nutrition Foundation of India, is now the chairperson for the lecture. I now request Dr. Anupa Sidhu to give a welcome address and introduce the KPS lecture series. Dr. Anupa Sidhu.
Thank you, Pulkit. So my warm welcome to this 48th Kamla Puri Sabharwal Memorial Lecture. Welcome, dear past speakers, members of the governing body, retired faculty, faculty of the college, alumni, guests, masters and doctoral students, members of the Sabharwal family. This is a flagship event organized by the Department of Food and Nutrition, Lady Irwin College. Our special thanks to late Mr. M.M. Sabharwal for instituting the lecture. He made it to attend all these lectures till 5 years ago and gave his blessings to take this lecture to pinnacle heights with his friend, Dr. C. Gopalan. They both believed in excellence as a way of professional life. Dr. C. Gopalan also passed away in October 2019 and was the first KPS speaker in 1974. His presence is immensely missed. Mr. Sabharwal had instituted this lecture in 1974 in fond memory of his wife, Kamla Puri Sabharwal, who was the alumna of this college. She was posthumously awarded the Distinguished Alumni Award in 1991 for her distinguished work done in the field of nutrition in both US and Calcutta, in the communities at that time. She made the college proud, both nationally and internationally. In the same spirit, this memorial lecture has become prestigious in field of nutrition. Eminent speakers in past have enunciated some of the finest principles and flagged contemporary issues in nutrition through this lecture. Each speaker had a name in this field and was a complete authority on the subject. They center stage issues and concerns of professionals working in that area. They also brought some both national and international perspectives and enriched the audience and perhaps ignited minds of young students of the nutrition fraternity of both college as well as those in Delhi and outside Delhi. Today's lecture is on addressing all forms of malnutrition, lessons from global experience. is being delivered by Dr. MEERA SHEKAR, Global Lead, Nutrition, World Bank. World Bank Health, Nutrition, and Populations Global Practice. In this capacity, she provides leadership, support, and policy advice across the spectrum of undernutrition and obesity. She has repositioned nutrition agenda that led to a global scaling up of nutrition, SUN movement, SUN movement. She is the chair of the SUN Executive Committee. Dr. MEERA SHEKAR, we are indeed proud of you at Lady Irwin College and welcome you to deliver this 48th Kamla Puri Sabharwal Memorial Lecture. I extend my deepest regards and warm welcome to Dr. Prema Ramachandran, who graciously agreed to preside this function as she has done in past. Dr. Prema Ramachandran is Director, Nutrition Foundation of India, and has been a KPS speaker in 1996. Ma'am, we look forward to your valuable insight and presidential remarks. With your rich experience in practicing both health and nutrition in India, in Indian communities, and in Indian communities, you bring deep Indian perspective and insights. We thank you for your support for enabling this lecture. I thank you all for taking time out to attend this lecture. Thank you once again, Dr. MEERA SHEKAR, for accepting to address the body and deliver the 48th KPS Memorial Lecture. We really look forward to this lecture. Only yesterday we had the Founders Day. So this is a landmark event, not only of the department, but of the college. And another 2 years, and we will celebrate Golden Jubilee. We want all our past speakers to be right there. Welcome once again to KPS Memorial Lecture of this year. Thank you.
Thank you. Thank you, Dr. Sidhu. I will now read the Kamla Puri Sabharwal Memorial citation. Kamla Puri Sabharwal is an illustrious, distinguished alumni of the prestigious Lady Irwin College. Though no more, her memory has lived through the passage of time as an example of dedication and commitment to work worth emulating. Kamla Puri Sabharwal received the Diploma in Home Science from Lady Irwin College in 1946, and during her years in college, she nurtured her desire of enriching her knowledge in the field of nutrition. After receiving a diploma in dietetics and public health nutrition at the Institution of Health and Hygiene in Calcutta, she was awarded a scholarship for postgraduate study at Columbia University, New York, where she received her master's degree. She was actively involved in a research project in nutrition in Guatemala under the guidance of the eminent nutritionist, Dr. Nevin Scrimshaw. Kamla Puri Sabharwal returned home after her postgraduate study and continued her research in nutrition with renewed vigor and enthusiasm. She conducted an ICMR-sponsored study on the problems of malnutrition in growing children of low socioeconomic group in Calcutta. Her keen involvement and concern for the nutrition of the poor and underprivileged was further supported and encouraged by her loving husband, Mr. Mohini Sabharwal, who continued to support the cause in all earnest and sincerity. As a tribute to Kamla's memory, he set up the Kamla Puri Memorial Sabharwal Trust with a view to further promote the cause of the science of nutrition. Though unseen, Kamla's presence continues to nurture the budding nutritionists and enthuses them to take up the unfinished jobs that she unfortunately left behind her due to her untimely and tragic demise. In 1991, justifiably, she was awarded the Distinguished Lady Irwin College Alumni Award posthumously. It is now my privilege to introduce Dr. Prema Ramachandran, chairperson for today. Dr. Prema Ramachandran is currently the Director, Nutrition Foundation of India, an eminent name in the field of nutrition. She is a medical doctor by training. She was elected as the Fellow of the National Academy of Medical Sciences in 1985 and has also been its president. She has worked for the Indian Council of Medical Research for 25 years, first at the National Institute of Nutrition and then at ICMR headquarters. She has conducted various research studies in important areas of maternal and child nutrition. Dr. Ramachandran has also worked as advisor for health, nutrition, and family welfare in the Planning Commission for a period of 9 years, wherein she reviewed the national and state plans for these three sectors. She has been a member of the 12th Plan Working Group for Nutrition and Health. She's also a member of the Prime Minister's Nutrition Council. Dr. Ramachandran has been involved in the preparation of many important reports, and her research articles in the field of nutrition and health-related policy and program issues are very comprehensive and insightful. She has over 150 publications to her credit. She has also been involved in the training of survey personnel for measurement of various parameters and quality control procedures in clinical, anthropometric, and biochemical component of the annual health survey of Government of India. Dr. Prema Ramachandran has been the chairperson of the governing body and the Institutional Ethics Committee of Lady Irwin College. At the Department of Food and Nutrition, Lady Irwin College, we look up to her as a mentor who's always supportive and who willingly spares her time for us despite her many commitments. We look forward to a continuous guidance and support from you, ma'am. I now request Dr. Prema Ramachandran to conduct the proceedings of the lecture, to kindly introduce the speaker and give her opening remarks. Dr. Prema.
Thank you, Pulkit. We all of us are very, very happy to welcome MEERA back home to LIC, where she began her career in nutrition by completing her BSc and MSc. Subsequently, she completed her PhD from Cornell University. Since then, over decades, she has worked on projects aimed at combating initially undernutrition and micronutrient deficiencies among vulnerable segments of population in many countries, and gained enormous experience and knowledge on international nutrition situation, epidemiology of undernutrition and micronutrient deficiencies through multiple population-based studies. Over the last 3 decades, the spectrum of nutrition challenges have widened. Currently, all segments of population in all countries in the world are trying to cope with the triple burden of malnutrition and all their health consequences. MEERA moved with times. She led reposition of nutrition agenda at the global scale and set up the Sun movement. She serves as the chair of the Sun Committee and has contributed to the emerging aid architecture of Sun, G8 and D20 agendas for setting up process for food security and nutrition. She is the founding member of Catalytic Financing Facility for Nutrition that has evolved into the Power of Nutrition. She has led development of the first ever global investment framework for nutrition and co-leads with Bill and Melinda Gates Foundation, the Nutrition Financing Working Group for Nutrition for Growth. Money matters. You can never say it doesn't. And unless there is advocacy, getting the funds, and then comes the most important job, seeing that it reaches the right people in the right places, and struggling thereafter to ensure that the right results come and people benefit from these huge population programs. She has taken this task very seriously and had always been going wherever she has to go if this task is to be completed the way she feels it ought to be completed. In her current capacity as global lead for nutrition with World Bank's Health Nutrition Population Program, she provides leadership, support, policy advice for Bank's nutrition portfolio across the spectrum of nutrition problems, ranging from undernutrition and micronutrient deficiencies to overnutrition and obesity. She manages key partnerships such as Power of Nutrition and positioning of nutrition within the Global Financing Facility and World Bank's new initiative on human capital. That is her work profile. But she also has academic role, and she always strives to achieve both these. She has served as an adjunct professor in Tufts University, USA, and take any university in the world, UK, USA, India, Bangladesh, it doesn't matter. She has always gone as a guest speaker and lectured. Wherever she went, this academic aspect also had always been her focus, and we value her for that. She was the commissioner of Lancet Commission for Obesity, co-led by the University of Auckland, and she is the co-author of the Lancet Undernutrition series in 2008. She is the member of the expert advisory group for UNICEF's State of World Children's Report. She is in the external advisory board, Standard Index, Legatum Institute UK, and Cost of Obesity Advisory Group and advisory groups for the exemplars of Global Health at Gates Venture. You see, she does span the spectrum, and we look forward to listening to you, Meera. Welcome home.
Thank you very, very much, Prema, for those very, very kind words. Prema and Anupa, thank you very, very much. I really appreciate you're reminding me of things that I have almost forgotten. And I must say, I'm extremely honored to be invited to give this talk today. I want to say good evening to everyone in India and good morning to everyone in the US at this point. And I especially want to say thank you to the Sabharwal family that is here and that has instituted this lecture to keep Kamla Puri Sabharwal's memory alive. I also want to say I hadn't quite paid attention to it, but my mother's last maiden name was Puri as well. So I think there is a connection there that I value very much. So thank you again for this amazing honor. And I'm going to give you a talk that sort of takes you, that will start across the world on a globe and then take us back to India, because that is, as Premaji said, that is our roots. And that's where I started my career at Lady Irwin, which I'm very, very proud of as well. So let me get started with the presentation. Give me 1 minute to put it on. Do you see the slide set?
Not as yet.
Okay. 1 minute. Do you see it now?
Yeah.
Yes, yes.
Excellent. Okay. Thank you again very, very much. Like I said, I'm truly honored and I'm a little choked up with the honor that you've given to me. So today I'm going to talk about addressing all forms of malnutrition, bringing the lessons from global experience to what does it mean for India and how can we do things differently in India. So just to get started, we all know that the first 1,000 days of a child's life is critical for brain development. And what you see on the slide here is the brain structure of the brain of a healthy, well-cared of, well-nourished child. And here is a child's brain, a brain that has been stunted. So you can see that there are differences in the structure of this brain that are very hard to undo if you intervene after that age. And if you see when most of the development in the brain happens, whether it is sensory pathways, language pathways, or even higher cognitive function, you see that it starts during pregnancy and until at about the age of 2, which is the 1,000-day window of opportunity that we all talk about. That is when the most brain development happens. And that's why we've always said, based on this research, that we should really focus on these first 1,000 days. And we know that if we invest in nutrition in the first 1,000 days, it's important from a schooling point of view. Evidence shows that it leads to increase in school completion by a year. It increases earnings by 5 to 50%, reduces poverty, and so on and so forth. And the cost of inaction in this space is extremely high. So we really want to be able to act in this time period. Premadu, you referred to the human capital agenda. So at the World Bank, we've developed something called the Human Capital Index, the story of how much human capital can a child who is born today, how much can she acquire by the time she is 18 years of age, given the environment that she's living in. And the three components, the three building blocks of human capital are survival. Does she survive? How much does she learn in school? And then health. What sort of health is she in? And if we unpack the human capital index, we realize that nutrition is such an important part of every component of this index. And it's both undernutrition and obesity, the whole spectrum of malnutrition. If we look at survival to age 5, for example, I think all the evidence in the world tells us that about 45% of under 5 deaths are attributable to undernutrition. If we look at the quality of learning in schools, we know that stunted children or anemic children, they either drop out or they learn less. And we know that iodine deficient children lose up to 13 IQ points. So nutrition is absolutely critical for the first two elements. If you look at health, within health, there are two components that have been developed. One is child stunting rates, and we all know that is a key marker of undernutrition. And the second subcomponent is adult survival rates, which is the fraction of 15-year-olds who survive to age 60. And we know that obesity, increasing obesity rates contribute to non-communicable diseases, and that leads to reductions in adult survival rates. So why do we care about nutrition? I think this audience knows that very well, but just to summarize, there are 149 million stunted children across the world and more than 2 billion overweight, obese individuals. Up to now, we used to think overweight obesity is a problem of the rich, for the rich countries and the rich people. But actually, if you see the publication we did last year on health and economic consequences of obesity, we showed that actually more than 70% of overweight, obese individuals actually live in low and middle income countries. They don't only live in rich countries. And this, as I said earlier, has negative effects on both human capital as well as their productivity, both for their own families as well as for the country itself. And so we've often talked about nutrition being a moral imperative. Yes, it is. And when we did the repositioning work that you talked about at the World Bank, everybody wants an economic imperative. So that's what we started to do. And we've shown that nutrition is something you want to invest in. It's not just a welfare issue. And even for businesses, they are losing large amounts of productivity because of malnutrition, because their employees are not as productive as they can be. If you look at the economic impacts of obesity, which is something actually new that has come through recently, you will see that those impacts are huge as well. So I mentioned already that there are 149 million stunted children as per the most recent data. And if we see South Asia carries a large part of that burden, South Asia and Africa and some parts of East Asia. And that's why we focus so much on these regions. I won't go through the numbers on this, but I think the map tells us in itself. And if you look at obesity rates, this is the picture on the left-hand side that you see, which shows obesity rates in the 1990s. That's how it looked. Darker colors means higher rates of obesity. If we look at the 2010s, then the colors are changing. I don't want to spend a lot of time going through actual numbers, but just to show you that just from looking at the colors, you can tell that obesity rates are increasing all over the world. And like I said, 2 billion adults globally, and a large percentage of them, more than 70%, in low and middle income countries. And that increases the risk, the cost of NCDs and mortality linked to that, but also COVID-related mortality. And I'll talk about that in just a minute. I've already emphasized that many of them live in middle or low-income countries. And if this is a very new report that was published by the World Obesity Federation and RTI International. And what it really shows is that in 2019, countries were losing up to 1.8% of GDP to obesity-related issues. And the projection is that by 2060, it will be 3.6% of GDP. And they did this study in 8 countries, and you will see India is part of the 8 countries where they did this analysis. It's projections, it's economic projections, but it is very, very sobering. So it's something for all of us as Indians to think about and say, what are we going to do about this? And how soon can we address it? Premaji, you referred to the double burden of malnutrition and even the triple burden of malnutrition. In addition to undernutrition and obesity, there is another link, which is climate. And those of you who saw the Lancet Commission on Obesity, it talked about the syndemic, a new term, the syndemic of undernutrition, obesity, and climate change. And these 3 things are really very closely related. And for a country like India, it's really important to address all of these things together because climate has an impact on both of these things, both undernutrition and obesity, and likewise as well. If we look at the estimates of the trends of what is happening across the world, you see that black line on top that shows the numbers of stunted children, wasted children, and overweight children. And even just looking at children, not adults, we see stunting rates, they are going down, numbers are going down. Wasting rates are going down as well, though India still has very high rates of wasting. But obesity, overweight rates, you see that increasing trend. And that is happening in most regions in the world, including South Asia, but perhaps much more so in East Asia. And if we look at the numbers of stunted children and overweight children, again, by region, SAR is South Asia region, EAP is East Asia and Pacific, AFR is Africa, and then Latin America, Eastern Europe, so on and so forth. And you can see that most of the burden of stunting is either in South Asia or in Africa. And if we look at the burden of overweight, it is relatively smaller in South Asia for now, but as you saw earlier, it's growing. And in fact, overweight rates are highest in East Asia, Middle East, and numbers of overweight children. And overweight children produce overweight adults. So this is something we want to stem right away. And the good news is that many of the strategies that we use to address undernutrition can also address overweight and obesity. One more thing I want to remind ourselves, that we always think malnutrition is a problem or undernutrition is a problem of the poor. These are data from NFHS 2014, 2015, so they're dated. But nonetheless, all I want to emphasize, I put two countries over here, India and Ethiopia. It doesn't matter which country you look at. Almost every country, we see this trend as we are seeing in India. In the poorest quintile or the poorest 20% of the population in India, certainly stunting rates are very high, 60% in 2014, 2015. As wealth improves, so you go from the poorest quintile to the second, to the middle, the fourth, and the highest, stunting rates do go down. But to me, what was quite a shock in looking at these numbers is that even in the highest quintile, the richest quintile in India, which is the extreme right graph, bar on the India slide, even there in 2014, 2015, almost 25% children stunted. And what that tells us is that it's not just a poverty issue. It's more than that. It's knowledge, behaviors, breastfeeding practices, those sorts of things that can have an impact. So I just wanted to emphasize that before we go on to COVID. Nobody can have a conversation today without talking about COVID. And we know it's led to disruptions in supply chains. What that means is increases in food prices. It's led to disruptions in health and nutrition services, lifestyle changes like Premaji and I, we were talking, we've all been stuck inside our homes as a result of COVID. So it leads to more sedentary behavior. And of course, economic impact on income, especially among the poor. So it's been a huge blow to malnutrition. And this one estimation that we've done shows that whether three different scenarios, optimistic, moderate, or pessimistic, and this is for global levels. And I will only give you the pessimistic numbers because that's what seems to be coming true, unfortunately. We anticipate more than 13 million additional wasted children in the world as a result of the COVID pandemic alone. And another 3.6 million stunted children in the world. I don't have the numbers for India, the projections specifically for India, but if we look at proportions, we anticipate many of them will be in India as well. So this has been a huge blow. Instead of improving, we anticipate there will be declines. And then we've seen some increases in obesity. And this is a study we did with Barry Popkin, which shows that obesity actually increases COVID-related deaths by as much as 48%, and hospitalization rates by 113%, ICU admissions by 74%. So huge increases in morbidity and mortality due to COVID because linked to obesity. And that, again, is a huge concern. And I want to emphasize that these numbers were estimated based on meta-analysis, but done before the Delta variant hit. So we anticipate it might be even higher. Bottom line is that both undernutrition and obesity are associated with significant reductions in immune function and susceptibility to COVID. We are seeing reductions in physical activity, and in most regions, we're also seeing rapid increases in consumption of ultra-processed foods, which we all know are very bad for our health, and less nutritious foods because prices are going up, especially for the poor. So lots of problems, lots and lots of problems to deal with. How do we address some of these problems? For the undernutrition side, we have developed this investment framework for nutrition where we have identified a package of interventions that have been shown to be effective. It doesn't mean this is a prescription. Just want to emphasize, this is a package that every country then adopts and adapts to its own context. But this is a good general assumption of where we want to put our investments. So if we look at it, roughly this adds up to about $10 per child per year, and globally $7 billion per year, which is not a large amount of money, not for a country like India. And of course, this we anticipate will be additional investments over and above what we invest in water and sanitation, women's education, which is extremely important, women's empowerment, which is critical in India, and food availability and diversity. So that is on the nutrition specific side. In addition to that, we've done a lot of work with the Exemplars group that shows that reducing stunting means you want to invest in what I refer to as nutrition specific or direct nutrition interventions, but also indirect interventions that are outside the health sector. And I won't go through the details of all of these, but things like fertility, teen pregnancies, parental education, all those are important as well. And here we have a list of a few countries: Peru, Kyrgyzstan, Nepal, Senegal, Ethiopia. All of them have used a different approach depending on the epidemiology in that country. So you take the evidence, the best evidence, and then tailor it to the country context. On the overweight obesity side, we have a little bit less evidence. It's emerging. We know some things, particularly learning from countries like Chile and Mexico that have had some success. And actually just last week, there was a study published from Seattle as well, Seattle in the US, that shows doing some of these things does lead to reductions in sugar intake, because sugar is really the thing that we need to cut back on. In the past, the evidence told us that we should cut back on fat. The new evidence is telling us it's actually sugar that does much more damage to our health than fat does. I'm not suggesting we go overboard on fat, but I am saying that sugar and carbohydrates are really, especially in an Indian diet, that's really something we need to be mindful of. So there are a list of potential strategies. Again, there is no prescription for any country. Every country needs to think which of these will work best in our context, whether it is taxing unhealthy foods. I think there are 47 plus countries that have put taxation on sugar sweetened beverages, for example. Nutrient profiling models, Chile has done an incredible job of that with front of package labels that with high sugar foods, they put a big stop sign on that saying, do you really want to give this food to your child? Limiting access to unhealthy foods for children. So regulations around those things, working with schools to improve nutrition quality of food services, so on and so forth, and including physical activity for children and quality of food systems. So there's a whole range of interventions that can be put into place. And I know we did a brief case study on Kerala, our team had done that, which was very interesting as well in this space. Now, I don't want to say that it's not possible to change these things. If we look at countries that have done extremely well, Peru is one example of a country that has done very well. And what was their recipe? very high level political commitment, huge media coverage with a focus on key interventions, as well as changing social norms around breastfeeding and complementary feeding, all the things that we as nutrition people worry about a lot. And then they really focused on results-based financing and incentive systems for improving the quality of the services, as well as Peru did something quite incredible, that they integrated nutrition into their social protection schemes, and they were among the few countries to do it at scale. And as you can see by the trend line in the middle, they've been able to reduce stunting rates from 28% to 14% between 2005 and 2014. So very impressive improvements in Peru. Then a country like Senegal in West Africa has done, again, very similar strategy. And the impressive thing is that Senegal was the only country in Africa that met the nutrition MDG in the MDG era, before the SDG came on board. And the other important thing is, if you look at the graph on the left-hand side, the stunting rates, which is the blue line, were going down even when economic growth was going down. So it's not improvements in poverty that led to improvements in stunting, but in fact, the improvements in stunting that may have driven the improvements in economic growth. So that's a very good lesson in terms of how to do particularly a multi-sectoral strategy with evidence-based interventions and a focus on community mobilization. That was Senegal's recipe for success. This is a very complicated slide, so I'm going to simplify it for you. This is Rwanda, an amazing country. If you have a chance to visit Rwanda, it's the Kigali is the cleanest city in the world. In the world, I want to emphasize that. I've never seen a cleaner city. The president and everybody else comes out every third Saturday of the month to clean the city. Everybody's out on the streets cleaning it. What is Rwanda's recipe for success? They have a stunting prevention project, they have a social protection project, they have an education project, and they have an agriculture project. And all of these projects come together under a stunting reduction program. So really a multi-sectoral approach. And again, lots of innovations that they are doing in terms of digitized innovations. We are also doing a very careful, rigorous evaluation of this large-scale program. And believe it or not, even though stunting rates have are still declining and well, but not as fast as we would like to see them in Rwanda. On wasting, Rwanda a few years ago was 2.5% wasting. Today, they are at 1.1% wasting rates, which is well beyond the SDG targets as well. And again, their secret is simply doing the right things at scale and focusing on quality. So I'm going to try and summarize some of the global lessons. High-level political attention, a focus on evidence, high coverage of key interventions, and a focus on quality. I will keep emphasizing that. Convergence across many sectors, trying to do results-based financing wherever it works best. And a very strong nationwide communication program. That is absolutely critical as well. In Peru, the Prime Minister himself would come on television and talk about why stunting was bad for children. Decentralized capacity for service delivery, especially in a country like India. And of course, monitoring and evaluation and course correction. And if we say, what does this mean for India? We already know that the Prime Minister is leading the Poshan Abhiyan. We need to sustain this focus. And I understand that there's a Poshan 2.0 that is being discussed as well. So this is the time to bring the focus, to continue the focus, because India has had the focus on the first 1,000 days. get coverage of a high coverage of the key interventions, and then a focus on quality. We're already seeing in India convergence across sectors. Perhaps we could use some tools like scorecards and others to monitor this sort of convergence. And I will keep emphasizing results-based financing is absolutely critical. On a communication side, certainly the Jan Andolan strategy that was introduced under Poshan has served well. But it's a periodic thing, and perhaps we need to think about doing this on a constant basis, as well as engaging some private sector agencies that know how to sell these ideas. Decentralized capacity, I've already talked about. Monitoring and evaluation, certainly the ICDS CAS that was developed some years ago. I was in India when we came to see it. It was very impressive. And we hope that this sort of monitoring and evaluation will continue. I'll now go back to the global world. All of you have seen or heard about the UN Food Systems Summit that was just concluded. And we are all getting ready for the Tokyo Nutrition for Growth Summit, which is on the 7th and 8th of December in Tokyo. And given all of this, 2021 is really a make or break year for nutrition. The focus for N4G, as we call it, Nutrition for Growth, is 5 areas: health, we've talked quite a bit about it, food, resilience, but also accountability and financing. As Premaji said, after all, money talks. So for financing, our mantra has been, yes, we need more money for nutrition, but we also need more nutrition for the money that is being spent to get more impact. So what do we mean by more money for nutrition? Certainly domestic financing and catalytic innovative financing sources are important. But if we think about other resources like diet-related taxation that can increase fiscal space in India, that is an option. Some countries like Mexico are exploring SDG bonds, floating sovereign bonds, to get more money. So whatever works, again, for every country is important. But we also want to focus on delivering more impact for the money that is being spent. And that means evidence-based planning, assessments, evaluations. So very quickly, I know we're running out of time. How do we get more money for nutrition in India? If we look at the MWCD budget, it's about 1% of central government budget. And while that's good, we haven't really seen an increase despite the focus on Poshan Abhiyan. You all probably know this better than I do, but I thought it was useful to share where we are at the moment in terms of financing. So I won't go through the details of this slide, but also remind ourselves that some of the nutrition expenditures are outside of MWCD. And so there are other ministries and efforts, the National Health Mission, and so on, and Swachh Bharat, which has spent a lot of money on nutrition sensitive interventions. And that is great. But if you look at this graph on the right-hand side, a lot of investment on the nutrition sensitive side, but nutrition specific, we really could think about scaling up that investment. Universal health coverage, every country is talking about UHC, and when we talk to the policymakers, almost everybody says, yes, we will include nutrition in UHC, but when we say specifically what is included, nobody's quite clear. So if we want to get money out of UHC budgets for nutrition, we need 3 things: a clearly defined package of nutrition services, preventive nutrition services, financing strategy that enhances what we call allocative efficiency, which is basically impact, and then an integrated system to monitor the expenditures and the deliveries and results. Same sort of thing we can use with social protection systems and cash transfers as well. We can get money for nutrition out of the social protection programs. And that's something we all need to think about. How do we get more nutrition for the money? Again, if we look at the MWCD budget, we see that much of the focus is on the right target groups. And that's really excellent news. Where perhaps we want to be thinking about a little bit is adolescent nutrition. That's where we might want to increase some budgets and some focus over time. In addition to that, one can gain additional efficiency of spending by using tools that other sectors use. For example, for public financial management, many countries are doing public financial management assessments to see how the expenditures are linked to outcomes. And I've put a few examples. Bangladesh has done it, Tanzania has done it, Rwanda has done it. Many countries are doing that, and really improves the efficiency of their spending. Indonesia is doing that right now as well. In addition to that, there's something called Optima Nutrition, which is a tool that we've developed, again, to help countries optimize the allocation of resources to priority interventions. And we've done trainings in many countries, including in India. We've done, if I remember correctly, we did 2 trainings in India as well. And essentially it says, if you have 100 rupees to spend on a nutrition package, how will you allocate that to get the maximum impact? Should you put more money into iron supplementation and less into vitamin A, or more into something else? So essentially it's a model that runs a tool. Again, there's no prescription that comes out of it, but just simply ideas for how to improve the impact of the money that we are spending. In addition to that, many countries are doing nutrition public expenditure reviews, which basically tells you how much is being spent on nutrition and how well. And that's been very helpful for countries as well as tracking financing for nutrition. And again, Indonesia is doing an incredible job on that, and they're changing policies based on that. So what does all this mean for India? We've talked quite a bit. In terms of the challenges, I don't need to emphasize this. I know all of you have seen this, know this much more. We are seeing improvements in stunting, though some states and some districts are falling behind. Wasting, we still have high rates of wasting in India, especially if you compare with, say, a country like Rwanda, where we've seen amazing changes. Anemia is still an important agenda, especially anemia for women, and in pregnant women in particular, but also adolescent girls. So those are the big challenges for India. We've seen, I want to emphasize, we have seen some improvements over the decade, but perhaps not as much as we would like to see, or we need to see in order to improve things. And this is a very interesting data sheet that I actually borrowed from IFPRI that shows by state which states are seeing improvements in stunting, wasting, underweight, and overweight. And it's worrisome if you see, I mean, everything is worrisome, but on the right-hand side, the overweight side, all of the arrows are going up. All of the arrows are red. It is really worrisome. Same thing on some of the other indicators as well. So in summary, we're seeing a steady decline, but stagnation in some countries, in some states. Anemia remains a huge problem. In terms of immediate determinants of undernutrition, exclusive breastfeeding, adequacy of complementary foods have improved, but we are still not where we would like to be. Antenatal care coverage and iron folic acid supplements certainly has improved. That's good news. And coverage of services has improved, but perhaps we need to focus again, as I said, on quality. In terms of underlying determinants, huge improvements in water and sanitation, which is very, very impressive. And it shows if you have high political commitment, you can really get improvements. Same thing, improvements in women's education and marriage before the age of 18. And where we need to think very hard and pay attention is the potential implications of COVID-19, as I mentioned earlier on. So as you all develop a renewed vision for Poshan 2.0, I do want to say, we want to think about all of these things. We want to bring all of this global experience into that and see what India can learn from that, but also what other countries can learn from the successes in India, because the scale at which things happen in India can influence the whole world. And the fact that we are such a decentralized country, that has huge lessons for other countries as well. 2 or 3 years ago, we brought a whole team from across the world to learn from India as to what is being done. And the team went away very, very impressed. So there's a huge learning across countries that can happen. I'm going to finish with this, the mantra of the 8 areas that we want to focus on. I won't go into the details of any of these issues, but just to say, as we work towards Poshan 2.0, we are lucky to have high-level political commitment, but we need to leverage that to make it visible and also get commitment at the decentralized levels from panchayats and states. And the focus on evidence is already there. We need to enhance that focus and add the focus on adolescent girls particularly. I have said enough about improving coverage, but also quality of implementation as we develop Poshan 2.0. The convergence focus is, India is the ideal country to bring about this kind of convergence, using certain kinds of tools and results-based financing. Again, I've mentioned a nutrition communication strategy. If we could have a massive communication campaign, I know India did an incredible job with communications on the HIV/AIDS area, for example, and that really helped address the issue. So we can think about really enhancing a communication campaign, TV, social media, radio. Somebody once gave me a statistics that at that time, which is probably not true after the WASH campaign, but at that time, there were more cell phones than toilets in India. And we have not leveraged the power of the cell phone in terms of using communication, that as a tool for communication. And nothing can happen unless we have program management capacity and to implement this very complex program, as well as monitoring and evaluation, so that we can learn from ourselves on how to improve programming. So with that, thank you very much. Again, I'm extremely grateful to you for giving me this opportunity and very honored. Thank you.
Thank you so much, Dr. MEERA SHEKAR, for delivering the 48th Kamla Puri Sabharwal Memorial Lecture. I now request Dr. Prema Ramachandran to give her concluding remarks.
Thank you. MEERA enjoyed listening to that really comprehensive review of global and Indian nutrition scenario and the lessons that India can learn from the world, and also perhaps what the world can learn on some areas from India. Really a comprehensive review I'm sure everyone enjoyed. They will use your slides to dig into greater and greater depth into areas of their interest. And that is an additional input that you are providing as a teacher. You see, some things never leave us. We love to teach, we will continue teaching, irrespective of whatever else that we do. So many of your slides and thought-provoking queries, I'm sure will make some of the faculty and senior students to dig into their own areas. And that is a very, very important contribution. For decades and decades, nutrition and health professionals had always tried advocating, oh my God, it is all important. It is a human right, right for life, right for nutrition. Nobody heard us, And they always called health and nutrition as expenditure ministries, as if we are, terrible people who call and grab money and waste it down the drain. Lot of the work that many economists in India, supported by WHO, World Bank, and across the globe, economists, health professionals, and nutritionists combined their knowledge and skills to bring out the fact that, if you want your country to develop, if you want a GDP growth, if you do not want a drop in GDP, you will have to invest in human resources. And if you don't, you are a loser. You do not understand the importance of human resource. If you want economic resource and development, you have to invest for development of human resources. This is one message that came extraordinarily strong right through your lecture. And I'm sure it will help the allied science people to help the nutrition professionals to get adequate funding for the huge task that we have ahead of us. For decades, India and South Asia worried, oh my God, we have the highest rate of stunting. We have the highest low birth weight rate. We have the highest underweight rate. We have the highest wasting rates. How can we cope with the high prevalence and high numbers? Can we ever get out of it? Well, today we also know that of the indices, the one that will really matter by far more is going to be wasting and obesity. And if you're going to look at these indices, yes, we have high wasting rates, but you can identify. And one of the greatest things with wasting is, unlike stunting, which you will invest today and wait for results 10 years from now, which may or may not come. With wasting, if you invest in giving the right food, the right amount, and take care of infection, in 6 months, you could bring a market reduction in wasting rates. So it will convince the population that you know what you're doing, you know where to go. And if they come with you, we will walk a long way towards reducing one type of undernutrition that matters. In the other, we have the golden opportunity. You showed in your slides that South Asia has the lowest overnutrition prevalence. In terms of numbers, because we have numbers in everything, we will have high numbers, but prevalences are low. Can we really make the best use of this opportunity and ensure we halt the rise in overnutrition clearly now, so that it is not only now and children, but tomorrow and day after tomorrow and the next 40 years, health and nutritional status of South Asians would be an envy for the rest of the world. Can we do it? I believe we can. I believe we have the resources and we have caught it very, very early. And I really hope your lecture inspired them to explore this possibility. COVID and climate, of course, both are global challenges. climate undoubtedly is a very, very troublesome thing for South Asia. We are one of the worst affected, though we contributed the least to the calamity. We are trying to increasingly invest in mitigating strategies, educating people to cope with it, because I'm not very sure how far we will be able to set targets. That is easy. Achieve targets, which is damn difficult. So mitigating strategies for adverse impact reduction, I think that should be the focus of India and South Asia for the current. What about COVID? I honestly do not know. I was very, very hopeful after the first wave, and the second wave came and literally swept us into a disaster. Will we beat the third wave? If we do, oh, great. But will we? It is still very much on the unknowns area. You also outlined that the three major problems that India faces are stunting, wasting, and anemia. And anemia remains absolutely unchanged for decades and decades. There is very often some new technology that comes in, which will make a huge difference, like mobiles did for communication. Will iron fortified iodized salt achieve it for India? After all, we need 8 to 10 more milligrams of iron in the intake. We eat 10 grams of salt. Take WHO, take not take WHO. We are salty people. We eat 8 to 10 grams is the minimum that we get across India. So if you use iron fortified iodized salt, 8 to 10 milligrams of iron will go in. Can we really push this single strategy and not get confused with multiple micronutrient fortification, multiple foodstuffs to be given over multiple programs? And instead, like what we did for iodization of salt, focus on one salt, focus on just adequate amount so that there is no excess worry. If we manage this technology upgradation through a single foodstuff, I believe that it is not at all difficult for India to achieve the 50% reduction in reproductive age group women anemia. But it takes, as you rightly said, political will, economic inputs, education, and communication until everybody is convinced. Finally, what is your last message? Look around the world, learn from what worked, where it worked, and why it worked. See how far it applies to you. Adapt it to your population and use it. And do not ever get overwhelmed by the fact that we had undernutrition and micronutrient deficiency. Now we have overnutrition. They also tell undernutrition predisposes to overnutrition and NCD. Here comes catastrophes bundled. No. Disarticulate them. They are small and manageable. Do it well. All can be well. This hopeful message is what I got from your entire sum up in the end. We are all very grateful to you for having left us with this positive message in an environment where very often you feel, oh my God, can we do it? If we say we can, I think we can. Thank you.
Thank you so much, ma'am. That was so beautifully summarized.
Pulkit, can I answer one question that I see several questions on the chat line, but there's one that I really want to answer, if I may take 1 minute.
Sure, ma'am.
And that's the question of by an anonymous person. He says, how do you convince government stakeholders in India to do rigorous third-party evaluations of programs? And my answer to that is, if we want to improve the efficiency of spending,
Thank you so much. I now request Dr. Anupa Sidhu to present the plaque of appreciation to Dr. MEERA SHEKAR. Dr. Kanika, can you project the same? We can't see it as yet. Yeah. Ma'am, you're on mute, ma'am. Dr. Sidhu.
So although this is a soft copy of the memento, the hard copy will reach you. And this will remind you of what a wonderful session we have had, and inspiring, especially for the younger generation, and very consolidating for people like us who look back from past experience and will repath the future. So I think that was very inspiring journey, and thank you for making it as a very insightful, valuable, and a loaded talk from experience. Thank you, MEERA ji, for delivering the 48th Kamla Puri Sabharwal Memorial Lecture, and you carry this memento from Lady Irwin College, and let it remind you for more good work so that you come back again and again for good work. Thank you.
Thank you, Dr. Sidhu. Now, I will just propose the vote of thanks. On behalf of the Director, faculty and students of the Department of Food and Nutrition and Food Technology, Lady Irwin College, it is my privilege to propose a vote of thanks to Dr. MEERA SHEKAR, who has delivered the 48th Kamla Puri Sabharwal Memorial Lecture on addressing all forms of malnutrition, lessons for India from global experience. I thank you, Dr. MEERA, for your excellent presentation of the topic. Your lecture highlighted how it is both morally and economically imperative to invest in nutrition if we want to build human capital. It discussed the Nutrition Action Framework for India and strategies for nutrition financing to tackle the problem of both under and overnutrition. It was indeed very thought-provoking. I also thank Dr. Prema Ramachandran for graciously chairing this session. We are grateful that you're always there to support us and guide us, ma'am. I thank our director, Dr. Anupa Sidhu, for her guidance and hand-holding at every step in organizing this lecture. On behalf of the department, I place on record our gratitude to late Mr. M.M. Sabharwal for instituting this series of lectures, which provide us an opportunity to hear eminent scientists from the field of food and nutrition. It is a great learning experience for students as well as faculty of the department. We as a department also wish to express our gratitude to the mentorship and guidance of late Dr. Gopalan. We remember him as the father of nutrition science in India and miss his counsel always. I sincerely thank all the faculty members of the Department of Food and Nutrition and Food Technology, Lady Irwin College, who have worked in various committees to make this prestigious annual memorial lecture a successful event. We had a great participation today. I think we went up to 158 participants. My special thanks to all the participants from India and abroad who have taken out their time from their busy schedules to be here with us. Thank you so much, one and all. Can we have
to everybody? I have to say, I see some very familiar faces. Vanita Narula, I see your face here. Hello. Vinu Seth, who was my teacher in college, is here as well, and I'm really overwhelmed. Thank you all.
Can I request you all to switch on your cameras so that we can have a group photograph before we end the talk?
Pulkit, can I say 2 words?
Yes, ma'am.
MEERA, I remember you as a student, and I remember that in your examination for food and nutrition, you had made a gelatin salad in a mold, which I have not forgotten till date. Number 2, I want to motivate each one of us. If we adopt 5 people in any area of our choice, whether obesity, anemia alleviation, wasting, and look after those 5 in our immediate neighborhood, will really be making a chain reaction. I thought as a community nutrition person, this could do wonders at the local levels. I want your opinion on it. Thank you.
Vinita.
Yes.
Narula.
Ma'am, Dr. Vinu Seth, can you switch on your camera, ma'am? Let's have a group photo.
But
Okay.
I cannot seem to. I don't know why. Oh, yeah.
Can I request all our faculty members also to please switch on their cameras? Dr. Dipesh, are we able to make everyone a panelist?
Ma'am,
No,
maximum
Pulkit, there's a
15 can
limitation.
be.
Yeah, there's a limitation of 15. We can't, so we are trying as we tried as many. So we that's why हमें जितने senior members को पहले तरह. So there is like we can't make more panelists.
Oh,
So we are
okay.
trying. I'm just telling him कि हमें हटा दो like the technical team and you add more people. So this is what we're trying.
Okay. Why don't you switch on your cameras and we have one click with all of you and then we can change the panelists.
Yeah, yeah. Just a second.
Oh, thank you. We change the panelist, I think. We go on to the next
Yeah.
group. Yeah.
Yes, ma'am. Yes, ma'am. We'll do that.
Dr. Sidhu, ma'am, आप अपना on रखिए. Ma'am, you're on mute.
So I'm saying I'm right there. Does it help others?
And we are facing a little glitch. It is.
So
Some,
great. We
yeah.
take a,
Okay.
I'm getting late, Dr.
Yeah,
Meera.
yeah. I
Yeah.
suppose.
I apologize to the others that we are not able to get you on camera for the photograph. We are so sorry. Yeah.
So
Yes.
thank you, MEERA ji. Thank you for sparing time and we won't hold you from your next commitment. So see you all. Bye-bye.
Thank you,
Thank
ma'am.
you.
Thank you, everybody. Bye-bye.
Good evening, ma'am. Thank you.
Bye,
so
MEERA.
much.